Hi. So I'm very happy to introduce Joanne. I'm happy she's able to do this. Joanne Fagerstrom has been a licensed physical therapist for over 45 years and a bone health specialist since 2009. She shares her work not only in public workshops such as this one, but also in her weekly Strong Bones exercise classes. In 2015, she released the second edition of her Strong Bones educational exercise video. Joanne is the owner of Mindful Physical Therapy LLC in Lafayette Hill and offers private consultations both in her office and virtually. And now Joanne's going to start and she's going to share her slides.
Okay, thank you so much for that. Just give me a moment here. Okay, slideshow from the beginning. It's always good to start at the beginning. And let me move you guys over. And sorry, I talk to myself a lot. There we go. Okay. All right. Well, thank you so much for being here and your interest in my presentation. So I have a lot to share with you, and we're just going to jump right in. So, okay, jump right in. I'm pushing buttons. Here we go. Okay, so I just want to take a very short time, not to get too far into the weeds with the biology of it all, but I think it's very important that we understand why exercise, why and how exercise works to strengthen our skeleton. So basically, the first thing you have to know, or we all have to know, is that bone is a living tissue piece. Many people don't realize that, and it undergoes this constant from the time we were born till the time we leave this planet. It's constantly renewing itself and rebuilding, and that's called remodeling. So that entire process of certain cells called osteoclasts, and we can think of them as the bone cleaners, removing old bone. It's a lot like a construction site, and other cells called osteoblasts, which are the bone builders, deposit new bone, and it takes about 4 to 6 months. And when more bone is removed than is formed, an imbalance is created, and that's why we wind up with low bone mass. And the reason I have this Georgia O'Keeffe painting here is because it's actually a pelvis in the New Mexico desert, and it just really is so emblematic in my view of how alive our bones are. So there's something called osteogenic loading, and there was a Julius Wolff was the person in the late 1800s that figured all of this out, that bone density and strength increase as a direct response to load, and load is anything where we're putting weight, we're holding weights, we're standing on our feet. That's a load. So bearing weight is the primary way we do this, and it's called osteogenic loading. And Wolff's law simply says that our bones are going to adapt to the loads under which we place them. It's really just we exercise, and the bones realize, okay, that we need to get stronger to be able to accommodate this new activity. And the opposite is also true. When we become much more sedentary, the bones actually begin to lose some of their mass. This is one of my favorite slides. So a researcher and his colleagues looked at professional baseball players, and what you can clearly see is the bone on the, now if you look all the way over on the left side of the screen where you can actually see the arm bone, and so that's the upper arm bone called the humerus. The throwing bone is actually bigger than the non-throwing bone. And then in the other little slides where you see the cross section, you can see that the bone is actually thicker in the throwing arm. So it couldn't be a more perfect sample because it's the same person and one arm is doing one thing and the other arm isn't. And so we can really see how exercise makes a difference. Now, once they stopped professionally playing, these benefits declined. However, they were able to maintain half of the bone size and 1/3 of the bone strength for the rest of their lives. So how cool is that? Now, bone mineral density, that's the data that we get from a DEXA scan. And it's interesting to compare that to bone geometry that can be tested in another way. There's a lot of evidence that demonstrates that when we load our bones, the bones adapt in a positive way, but many of these activities are not always reflected in our DEXA scan. So a researcher named Beck and his colleagues looked at over 6,000 women and found that the women who were more active had geometrically stronger thigh bones or femurs. And when we use bone mineral density as an outcome, these effects either were underestimated or not apparent whatsoever. And what's really amazing, I think, in this particular study is that most of the activity they were looking at with this group of women was walking. They weren't going to a gym and lifting like 50-pound barbells or something. They were just walking, doing household activities, just not being couch potatoes. And their bones actually, the geometry of the bones actually were reflected in those activities. So the key takeaways here is that exercise increases the mechanical loading of our bones, and this loading is sensed by the bone cells and is converted to a chemical signal, which then leads to the beneficial bone remodeling that we all want. Exercise can create a change in bone quality and strength without an apparent change in bone density. So I don't have time in this presentation to, and maybe I'll come back another time if you want me to really talk about the DEXA scans and how our bones are tested. But I think of a DEXA scan really as a blunt tool. So let's get into the serious part of our talk, which is what exercises should we do? There's a gazillion exercises out there, and there's a lot of research that has determined that combinations of the following exercises that I'm going to describe to you are best. So not just doing one thing, but doing a combination of things. So for the hip, simply standing on one leg strengthens that hip bone. I mean, I think that's amazing. I'm going to talk about that a little bit later. The femoral neck, which is where your thigh bone comes up and then kind of makes almost a right angle into the hip joint. That area where it angles in is called the femoral neck. So it's not your neck, it's part of the hip. And what has been determined is that weight training alone can make a difference there. And the reason they look at the femoral neck is because if a hip fracture is going to happen, usually that's exactly where it occurs. But also a combination of impact exercises like walking and also like Tai Chi. Lots of research about Tai Chi, which is very beneficial not only for balance, but also for our skeletal health. For the back or the lumbar spine, walking, Tai Chi, weight training, which is lifting weights, and combinations of these exercise types have been found to be most effective. But what we also need to understand when we embark on an exercise program is that we want to avoid certain things. And the number one thing we want to avoid is forward bending, which is called spinal flexion. So we don't do toe touches, we don't do sit-ups, and nobody's going to cry over that. You know, we don't do crunches. We either keep the spine in a neutral position or move it in a kind of a backward direction, which is called extension. But staying neutral, which is kind of just the position your spine is in when you're standing tall, that's usually the way we try to hold ourselves in various exercises. We also want to avoid a lot of twisting. So a little bit of twisting is okay, but taking it as far as you possibly can is really something you want to avoid. And a long-term commitment is essential. I mean, I have here the minimum of 6 to 48 months for really adequate bone building. But I've thought about deleting that part of this statement because you want to think about exercise as a lifelong commitment. And one example that I like to give is, you go to the dentist for some, your tooth is bothering you, and he takes care, or she takes care of whatever it is, and you don't stop brushing your teeth. You're maintaining your teeth for the rest of your life. And we need to think of our muscles and our bones in the same way. So let's talk about balance exercises and activities first. So this slide might be a little bit confusing, and I'll explain it to you. We in the class that I teach called Strong Bones, we use a variety of ways that we stand to challenge our balance. So at the very top, you see the 2 feet, one next to the other. It's called bipedal stance. It's just a fancy way of saying we're just standing in our normal way. But then, and I don't have a picture of this, we can also stand with our feet very close together where the inner ankle is touching. So that's called a narrow base of support. And that can be challenging balance-wise to some people. The next one is semi-tandem stance, where you have one foot in front of the other. Tandem stance is where one foot is directly in front of the other, like you're on a tightrope, where semi-tandem is kind of you're on a 2x4 or something. And then the very most challenging of all is at the very bottom, where you're standing on one leg. And keep in mind, and I'll say this again as we go along, that even if standing on one leg is challenging or even feels impossible to you, you can hold on. And you're still, you hold maybe a finger on the wall is enough. Maybe your hands are on the kitchen counter, because safety has to be our top priority, but you're still getting the benefit to your skeletal health by standing on one leg and helping your balance. So in class, we'll often combine ways that we're standing to challenge our balance and to kind of work a variety of muscles as we do a particular exercise. So the woman on the top left, she's wearing a red tank top. She's standing on one leg and doing a bicep curl. Right below her, there's someone who's in a squat, a little bit of a squat, and she's got a resistance band around her arms, and she's raising it up overhead. Right in the middle is, I used to have a studio in Windmore that I sadly lost because of stupid COVID. It was the love of my professional life, and it only lasted 3 years. But anyway, so that's me. We're standing one foot in front of the other, and everybody's doing the best they can. And we're standing tall, of course, and then holding dumbbells and moving our arms behind us. And I always talk about, don't just feel what your arms are doing, feel what your upper back is doing. Bring those shoulder blades toward each other. And then all the way over on the right is an exercise that I call leg clock, where we imagine we're standing in the center of a clock that's actually on the floor, and we move our right foot, for example, from the 12 to the 1, the 2, the 3, and so on, all the way to the 6. And we do the same thing on the left side. And then we also hover the foot over the clock to make it an even greater balance challenge. So I want to just hone in on this standing on one leg business, because there is really a good amount of research just lauding its benefits. So my favorite one of all is this first research study done by London and colleagues that found that for every second of somebody's ability to be able to stand on one leg, the risk of their fracturing a hip or breaking their hip decreased by 5%. That blows my mind, because 1 second makes a 5% improvement. So people who say to me, I can't stand on one leg anymore, I just can't do it. It's like, well, let's just get 1 second of it. And then maybe, so you've got your hands on the kitchen counter, and you let go for a second and you go back down. You want to be safe. And then maybe as time goes on, maybe it's 2 seconds, and now you've decreased your hip fracture risk by 10%. It's just really something that we can all do and just so beneficial. And then another study that came out more recently actually correlated the ability to stand on one leg with longevity. So they found that of these about 1,700 healthy women and men that were followed over 12 years, 20% of them couldn't stand on one leg for more than 10 seconds. And they found that that was correlated with a kind of a risk of what they call all-cause mortality. But what's important about this, because I don't want you to feel discouraged if you can't stand on one leg and think you're doomed. It's just that what happens over time is that we use some of these things as indicators for frailty. Somebody has become more sedentary. Lots of things have become more and more difficult. The inability to get out of a chair without assistance, for example. And so a lot of these things are kind of put together in this one bucket, looking at somebody's vitality. But it also, I included it here because it speaks to just yet another reason why we should practice that simple act of standing on one leg. So let's talk about strength training now. And I want us to focus on our back or our spine, our hips, and those are the two areas that they look at in the DEXA scans. The core is, working on abdominal strength, and really the core just wraps around the whole torso, and then the chest and the arms as well. This slide is really demonstrates nicely that it's whatever exercise you're doing is specifically strengthening a particular bone. So we've got over 600 muscles in our body connected to over 200 bones. It's the bone that the muscle attaches to in a particular exercise that's getting stronger. So this woman is doing a bicep curl, great exercise, but the only bone that's getting stronger is that arm bone, because that's where the biceps attaches. So she's not strengthening her hips, she's not strengthening her back. It's not that you don't want to do it, but you have to understand that some people just say, oh yeah, I'm doing lots of things for my bones, and they demonstrate they're doing these bicep curls. Well, you've got to do a lot more than a bicep curl to really get to where we want to get to. So what I will do in class, for example, with a bicep curl is let's put our feet in tandem stance while we do it. Let's go into a little bit of a squat while we do it. Let's maybe stand on one leg while we do it. So try to do that combination of things. In terms of strengthening the back, which is so important, it contributes to increasing the strength of our spine, not only the muscles, but the bones. It improves our posture. It decreases the risk of those compression fractures of the vertebra of the spine. So they're called compression fractures because, if you break your wrist and you have an x-ray, you can clearly see the break in that that wrist bone. But with a compression fracture, you get lots of tiny little cracks, and it kind of flattens out. And that's why they call it a compression fracture. So these things can be done in sitting. I mean, I don't teach any exercise in sitting unless I have to. Unless someone is, unable to do it in another way, then that's what we do. But if somebody can stand, we're going to be standing to exercise, or lying on the floor. But according to Murshid Sanaki, who I've cited down here at the bottom of the slide, and she's from the Mayo Clinic, she has found that getting in a face down position, which is called prone, a prone position, is very beneficial because it has a great, in her research, she found that it had a greater effect on decreasing the risk of those compression fractures. And we'll get into, I'll show you very shortly what some of those exercises look like. So, and they're called the T's, the Y's, and the I's, which I think of as the back strengthening triumvirate. So I will explain right now. So this is me in the studio before I shut it down. And I'm face down. I've got the top picture. I've got my head in the middle and my chin tucked. So I'm actually on my forehead and the bridge of my nose. And I have a big nose, so I can still breathe doing that. But some people like to put a little padding under their forehead, and that's fine. And then when the arms are out to the sides, like you're a giant letter T, and we raise the arms, shoulder blades coming toward each other. So we're not thinking so much that we're strengthening the arms, which we are. We're thinking about strengthening that part of the back that's between the shoulder blades. And then we move the arms on the floor overhead. So now you're like a giant letter Y, and raise the arms. It's much more challenging than the T position. Now the back, the part of the back that's being strengthened is the mid back. And then the arms come down along the sides. You're like a big letter I, and the upper body is lifted. The legs stay down. So that's the most challenging of all. And that is a particularly, Dr. Sinaki found that that exercise, the one on the bottom, the I, she found that the women, the postmenopausal women with osteoporosis that she had doing this exercise were able to largely prevent those compression fractures of the spine. And after I read that, I started doing this exercise because I hadn't done it. I had never done it before. And I was diagnosed with osteoporosis in my early 50s. And I was just so shocked, and to say I was upset is an understatement. And that's where I dove into the research. My doctor wanted me to go on Fosamax. I didn't want to go on Fosamax. And we kind of struck up this deal that I was just going to see, I was going to do some reading, change my diet, yada, yada. And I started doing all these back exercises. I don't have osteoporosis anymore. And that's what changed the whole trajectory of my physical therapy career, was just focusing on this work and sharing what I've learned with other people. So I'm also a Feldenkrais practitioner, and body awareness is key. So you never want to underestimate that. You want to continually monitor your alignment as you exercise. You want to pay close attention to that feedback you're getting from your body and make little adjustments, modify as needed, and make sure that you're actually using the muscles you're intending to strengthen. So Dr. Feldenkrais used to say things like, are you doing what you think you're doing? And it might sound silly, but many times we just become kind of disembodied and don't really feel what's happening in our body. And this is especially true when it comes to exercises to strengthen our hip and activate that buttock muscle. And that brings me to this slide. So this is an anatomical picture of what we look like from the back. And the big buttock muscle called the gluteus maximus is right there on the left. And then kind of under it a little bit, you see the gluteus medius. There's also a gluteus minimus. And I always joke that it sounds like, sergeants in Caesar's army. And then you've got all these other little hip rotators, the piriformis and others. But Stuart McGill, this exercise physiologist, he coined the term gluteal amnesia, which a lot of PTs also call dead butt syndrome, which is where you're trying to do an exercise to strengthen the gluteus maximus, that huge muscle. It's one of the biggest ones in our body, and yet it's not firing properly. And people, try to do, I'll show you in a moment, an exercise, and it's like, oh, that makes my back hurt, because the back is not meant to do the work that the buttock muscle is meant to do. So sometimes we need to start slowly. So the top image here, this is a person doing hip extension, bringing the leg backward for the sole purpose of strengthening that buttock muscle. but we talked about how important it is to get down on the floor. So sometimes people, that's a challenge unto itself. Lying face down might be not so familiar. So maybe you just lie face down and you hang out like that for a little bit. And then can you prop up on your elbows to work into that spinal extension position? And then we try to get a little more challenging, and these things can take time. So instead of hip extension and standing, this person is doing hip extension face down. Now, this is what I was thinking of a moment ago when I was saying somebody might do an exercise like this and say their back hurts. So the first thing that I'll say is tighten up that buttock muscle first and then raise your leg. And often that really makes a difference. Or don't raise the leg so high. That can also make, she's raising her leg pretty high. You don't need to go that high. The other thing that can help is putting like a cushion under the hips and the lower belly. The takeaway here is there's almost always a way we can work with whatever is going on to make it more possible. And then this is a person doing that eye exercise with the legs stay down, raising the upper body as a really wonderful back strengthening exercise. But you wouldn't start with this. That is hard to do. When I first tried to do that, and I thought it was like, oh, I'm so strong, I can do that. And I was like, really? Like I could barely get my chest up off the floor. My back was weak because all I was ever doing was sit-ups. So I was very imbalanced. And even as a PT, so I'm embarrassed to say that, but I'm just putting it all out there. And then there are other examples. So here, top left, this person's on hands and knees, and she's just raising that leg out behind her. Another way of doing hip extension. And below her, now it's an arm and opposite leg. So some people call that the bird dog exercise. Top right is a good strategy if somebody can't be weight bearing on their wrists or they can't be on their knees for some reason, and they can do a very similar exercise in that position. And then I've got another image here of the Y exercise for the back. So let's keep going here. So in terms of abdominal and core strengthening, what you don't want to do is a sit-up. Examples of what you can do instead, or what I have listed here. So I have them all listed out, but I think it might be easier if I just jump right into the pictures that come next. So on the left, on the back, neutral spine position, belly muscles pulled in, one foot stays flat on the floor as just a single leg comes up. You lower it down, then the other leg comes up, you lower it down. And so you're kind of marching in place with all of your focus being on that kind of stabilizing your center. And then it's like, okay, can we get the legs up off the floor? Some people need to slip their hands under the buttock area to make their back feel better when they do that. And then a small excursion of leg movement away from that starting position. And then on the left, making it harder. Now you're lowering your foot toward the floor. My toes are touching the floor. We call this toe dip. So it's as if you're dipping your toes in an imaginary pool of water. And you'll feel the work in your legs, but it's not about your legs. It's about what's happening in your core and really stabilizing there. And then to make it more challenging still, you lie on a foam roller as you do the same thing. So now you're on an unstable surface, and you immediately feel the additional challenge to doing that. And then I called it bird dog. I didn't make that up, but somebody told me that's what it's called. And it's like, yeah, that works. So what you want to make sure of with this exercise is that you keep the back in that stable, still position. So some people raise the leg too high and then they're getting some twisting in their back. What I often will say in class when we do this is imagine there's a tray of food balancing on your back, and then you raise the arm and the opposite leg, and you can't let anything fall off that tray. So, you're just really trying to think of that stabilization piece. And getting up and down out of a chair without using hands is a wonderful way to work your core, your glutes, your legs. It's just a fabulous exercise, and we'll get into it in more depth in a second. But it's something that, if you can, I want you to practice as often as you can, to not use your hands every time you get up and down out of a chair. Now, of course, if you have to do it, that's what you do. But sometimes we just do things because we just do it. You don't really think about, I could do it some other way. Now, of course, you want to make sure the chair won't move. Never do this with a chair that's on wheels. So, and then there's plank, and where you want to keep your body parallel to the floor. And then, if you can't be, see how much my toes are bent? So if you've got arthritis in your big toe, this is not a happy exercise for those toes, because they get stiff. And what you would do, and it's not a great picture because you can't see my lower legs, but you just would be on your knees and your forearms and do the plank like that. Like I said, there's almost always a way. And then there are heel drops. Lots of research about these heel drops, which are very effective in stimulating bone growth. And the heel drops are the genesis of them was actual jumping. So I don't have a picture of this, but what we do is just stand tall. We come up a little bit on, toward the ball of the feet, and then we drop down on the heels. And how much impact you use as you drop down is totally up to you. Even a little bit of a force, you can feel that vibration. And that kind of high impact, they also call it an odd impact activity, is very effective in increasing the bone mineral density of the hips and spine. It generates ground reaction forces, creates this vibration in the muscles, and that's what stimulates the bone growth. So everything is just so interconnected. And Zumba, dancing, hiking, in addition or instead of the heel bounces, certainly is more fun. But I do heel bounces. I just kind of sneak them in randomly throughout the day. They're so easy to do. And we'll talk about them again a little bit later. So let's just talk a little bit about endurance activities, which is anything that gets your heart rate up a little bit, as opposed to balance, pure strengthening, things that are more like cardiovascular related. So many times people will say, is walking enough? And what does the research show in terms of a decreased incidence of breaking a bone versus an improved DEXA scan? So Feskenich and colleagues found that even moderate levels of activity, including walking 4 hours a week, in her view, substantially decreased the risk of hip fracture in the group she studied, which were postmenopausal women. But Sherrington did a much bigger study and found that there was not enough evidence to support walking as a standalone intervention. So walking is great. I encourage everybody to try to get out and walk regularly, but I don't think we can, based on Sherrington and other studies as well, we can't just hang our hat on going out for a walk. Let's talk about why a brisk walk is better. So PTs and some other researchers are looking at walking speed as a functional vital sign. So, heart rate, respiratory rate, and so on, blood pressure. They're looking at walking speed also as another potential vital sign. Closely related to functional ability and balance, confidence, another indicator of vitality, and has been shown in many populations to be one of the single best predictors of functional decline and disability. And I saw that in my own mom. She'd moved in with us for the last couple of years of her life, and she was such a fast walker, and she just started doing so much less, but really walking slowly, walking very, very slowly. And so it was just right in front of my eyes, this this ability to walk fast, and what it kind of says about function overall. But the other thing is that some people aren't naturally fast walkers. The main thing as a takeaway here is, if you go out and you walk your dog, for example, there's going to be a lot of stopping and starting. And you also want to include then a walk where you're not stopping and starting, and you're walking as fast as you feel like you can. You can still talk to somebody, but you're not strolling. You're not in, like you're in a museum, kind of strolling around admiring the artwork. You're trying to get that speed built up. So yoga and swimming, let's talk about that. Is yoga good for your bones? Well, it can be, but you have to know the things that you shouldn't do. And I've included a lot of citations here. Lauren Fishman was one of the first people, excuse me, that looked at specific yoga poses as related to osteoporosis. I think it was first written up in the New York Times, and he's written a book, and um, you can find that information on the internet. But what we know, and again, here's Murshid Sanaki. She's a physiatrist, and she just has done a huge amount of research with related to osteoporosis and exercise. And what she's found is that the compressive forces on the spine are multiplied in certain poses, and it's because of the weight of the body put on the back, the way the muscles are contracting, the strain on certain spinal ligaments. And also, as we get older, we don't have the same elasticity in some of these tissues as we used to have. So we have to just be more careful, especially if we're new to an activity. And spinal fractures, those compression fractures, can happen when the loading compressive force exceeds the biomechanical competence of those vertebral bodies. So that takes us to the very beginning of my talk, when we were talking about Wolff's law, and and how all of this works. So let's look at some specific examples. All of these things I don't want you to ever do again. If you're doing them now, stop right away. It's especially top left, bottom right. This is a compression fracture just waiting to happen. The forward bend on the bottom left, it's a lot of spinal flexion. I mean, obviously this person is extremely flexible. I mean, I couldn't do that if you paid me money, but my hamstrings have always been tight. But it's not worth it, because, and I didn't include this in our talk, but I'm telling you now, the crazy thing is that most of the time we don't know that we have had a compression fracture. And that's a statistical fact. 2/3 of the time, they're called clinically silent. So, maybe it's like, oh, maybe I pulled a muscle and your back bothers you a little bit, and it goes away. Sometimes there's like zero pain whatsoever. But what you do find is you're getting shorter, a lot shorter. So 2 inches of height loss is almost always a compression fracture. So prevention is the name of the game. We don't even want to go down that road. So sometimes it just comes down to proper form. Over here on the left looks fantastic. On the right, all they have to do with that child's pose to avoid some of that spinal flexion is separate the knees. And then you can stretch through your legs and get a much, much better back stretch. And on the bottom right, she just needs to hinge forward from her hips. She doesn't need to bend down like that. She can keep that spine in the neutral position and still sit that way and get a very nice hamstring stretch in that position. So in terms of swimming, this was an interesting study that looked at over 600 people, all postmenopausal women, and she corroborated, what most people know is that water-based exercise is just not as effective as land-based. And in PT, we call it surf and turf. You got to get to the turf to really build those bones. However, and there's almost always a however, when the exercise was done frequently enough, the water-based exercise is better for your bone health than doing nothing. And so anything is better than nothing when it comes to kind of getting our bodies moving. And they did find that it decreased the bone loss, and some positive impacts were found on not only the bone metabolism, but also on muscle strength. And then looking at the clock over here, we're coming around the bend here. So if you're not supposed to round your back, how are you going to pick something up off of the floor? Well, you've got to learn how to squat. And well, squat keeps the back in a neutral position. There's no rounding there. The knees don't come in front of the toes, and the hips go way, way back behind you, like you're sitting on a chair that's too far back behind you. And this is what we did when we were little. Squats are truly a fundamental human movement that many of us lose over time. And so, you can't rush into squatting down to pick something up off of the floor, the way I was showing, but you can slowly get your body kind of used to that kind of movement. And it's just good body mechanics. And I know, because someone said this in another presentation that I did, that the relationship of the torso to the legs in a toddler is different than ours. Yeah, but you get my point, is that, we started and we were doing things in this wonderful way, and we can get back to that. So here's just some more pictures of me doing a squat here, top left. But sometimes if it's hard to keep your back straight as you're trying to nail down your form, keeping the arms way back behind you like a ski jumper is a great strategy to make it a little bit easier. The illustration of this younger person doing a squat is the way it's generally taught, the way you'll see it. I always teach it paired with body mechanics. So we're doing a squat, we're practicing picking a tissue up off the floor. It doesn't have to be something heavy, but it could be something heavy like a bin, a laundry basket. On the left, again, getting up and down out of a chair without using hands. And you can see it's the same squat. So if I go back, top left, you can just picture the chair back there. And now you're just, every time you get up and down out of a chair, you're doing a squat. It's a built-in exercise. It just, that we have to sneak these things in because we don't have time to exercise all day long. So I wrote a blog this month about these key exercises for building bone density. It's the squats, the heel drops, and the standing on one leg. And I've included this link where you could just click on that and go right to the blog. I kind of go into more detail. I write a blog once a month, and I try to keep them short on purpose, but I always include the whys of anything that I'm describing. And our key takeaways here are that multi-component exercises are what's best. We want to combine the aerobics with the strengthening, with the resistance exercises, the balance challenges. 3 times a week is ideal. Walking 30 minutes a day is great. And, it's not going to show a change in your bone mineral density, but it's a great thing to do. The exercises are very site specific, and they will increase the muscle mass and the bone density only in the stimulated regions. And due to the typical ongoing bone loss with age, all of the exercises really should be incorporated into a lifestyle change and be lifelong, as I said a while back. And the most important outcome is not breaking a bone, right? That's what we all want. We don't want to break a bone. So, if the DEXA scan isn't, you know, showing you what you wish it was showing you, it doesn't mean that you are not doing well by yourself by exercising, because it might not always be reflected in that one test. Oh, and there's no one size fits all. Never was there a truer statement. And quickly here, I could talk for another hour about nutrition. Obviously, we don't have time for that, but we really cannot talk about our bones without talking about how to feed them. And it's one of the modifiable things that we can do for our skeletal health. Dr. Haney from Creighton University, in his research, he believes that at least 1/3 of all osteoporotic fractures have a nutritional basis. And Michael Pollan, who wrote several books, but this one, Eat Food, Not Too Much, Mostly Plants. I love that. He just talks about how, I'm not a vegetarian, but I really largely am. And that is one of the things that changed after I got my diagnosis. All those years ago. So really looking closely at your diet. And according to the American Bone Health .org, it's a wonderful foundation that there's a lot of great information there, and they list all of these key nutrients for bone health, and you can see it's more than just calcium and vitamin D that we have to be thinking about. And here are some resources. So the American Bone Health, the Bone Health and Osteoporosis.org. It used to be the National Osteoporosis Foundation, and they just did a little branding change. And then you can read my blogs at my website if you'd like to. And then here's some contact info for me. So I'd love to get your questions now. I don't know if we should if I should exit out of the screen maybe, and so I can see all of you. Let's do that. Stop sharing. Okay, good. Now I can see faces. And so maybe you could, I don't know, what do you think, Myra? Like somebody just unmutes themselves and goes for it?
Yeah, that's what I think is a good idea.
Can people unmute themselves, or do you have to do that?
People can
Or do
unmute themselves.
Okay. And go ahead, Andrea.
I thought, first of all, this was absolutely terrific. I have a question about my favorite way to do abs, which is in one of the group exercise classes I like. You're, in essence, doing a crunch, but you're standing. You lift your knee, you put down your arms, and you tighten your abs. Any problem with that?
So I would just say you can do that, and we do that in class, but not rounding forward. So you're just, you're lifting your arm and your opposite leg and maybe going back and forth, but you don't need to round forward.
Like that.
Yeah, that looks okay. Well, you okay? No, that looks okay. What I wouldn't want you to do is really like try to
Right.
bring your head toward your knees kind of thing.
Thank you so much.
Sure. Go ahead, Fran.
Yeah, thank you. And thank you for this great talk and the slides. I really enjoyed it. I know I have osteoporosis in the femoral neck, despite 5 years on Actonel and doing all of these things, all of these exercises, walking, eating well, and still it went down in the femoral neck. So you mentioned the stuff to do for it included weight training. If you don't have time now, can you say where to find the right weight training for the femoral neck?
So things like if do you go to a gym?
Not since COVID.
Okay, that's fine. I just so I can so things like the toe dips, for example, with an ankle weight on would be good. Standing with either with the resistance band around your ankle or an ankle weight and moving your leg, you know, you go forward, so towards 12 o'clock and out towards 3 or 9 o'clock and then back towards 6. So you're kind of going forward, out to the side and behind could be good. But I also, the one, like, I mean, I don't want to get too personal, but have you, I mean, if you don't mind sharing, have you broken anything?
I did break my wrist, but it was a pretty hard fall. So, and they told me the bone looked good. It been broke. And I probably have compression fractures, as you said, I didn't realize because I have lost 2 inches of height.
Okay. Yeah. So, I mean, the main thing that we want to kind of think about is preventing the next fracture, and that's true for everybody. So, so in class, like in my class, we'll do things for the legs and standing, like that leg clock. We'll do something where let's see, you can see me here, like bring the leg up in the air and swinging it forward and back, and then out to the side and back. Doing the heel drops is really great. Face down clamshells, do you know what those are? Where you're lying on your side and your hips and knees are bent and you bring your top knee away and back.
Oh, yeah.
Yeah, there's truly so many exercises, but looking at things that you know, where you're moving your leg and the hip is moving, as opposed to like if I'm sitting here and I straighten out my knee, that's a knee exercise. It's not strengthening my hip. So you've got to be moving that hip joint. So kind of, if that helps, thinking like a bridge, lying on your back.
Okay.
Yeah. I mean, I there's too many to name.
I guess
And if you were ever interested, like checking out the class would be a way you might even just get an idea of some of the things that we do.
I have one other really quick question. I am a yoga teacher and I've been doing these things all my life. And most of the exercises that are shown are actually easy for me. And I'm wondering if that means I'm not getting the benefit or if I should do them anyway, even if they seem easy.
Well, so I mean, when somebody tells me it's easy, I usually say add more weight.
Okay.
I mean, how much weight are you lifting?
When I do weight exercises, I'm using 8-pound weights or 5-pound weights, depending on the exercise.
Yeah. So you could try, you know, I mean, there's a wonderful researcher up in Canada, Laura G.N. Gregorio, and there's another one in Australia, Belinda Beck. They are working with osteoporotic women and they're doing like 50-pound deadlifts. They don't start with 50-pound deadlifts, but they're working in that direction. So, you know, any doctor who says don't ever lift more than 3 pounds again because you're going to break your back, they're just not keeping up with the research. But, you know, you could increase the weight very gradually.
Okay, that's great.
Yeah.
Thank you.
Yeah.
There
So,
are a couple of questions in the chat.
okay.
Somebody asked, is there anything you'd recommend for someone taking an estrogen blocker for breast cancer?
In terms of exercise, I mean, all of these things are, you know, the one of life's injustices is that, you know, with breast cancer, you know, often are put on a medication that causes bone loss. And now you've got another problem to deal with. But what are you going to do? You just, you know, I mean, this is the sad kind of fact that's in front of us. And so bone strengthening exercises are critical to do in that case. I don't know if that answers the question or not.
I have a
And then
question.
Barbara, oh, let me see what Barbara has a question, then we'll get to everybody. Go
Okay,
ahead.
two quick questions. You didn't mention walking up and down stairs. And we live on the 5th floor of our building, and I try to walk up and down the stairs several
Great.
times a day. So that's
Love it.
okay.
Fantastic.
The other thing I do is push-ups on my counter, like when something's in the microwave, but I have no idea
Yeah.
what is that helping anything, and what is it helping? I have no idea.
It's helping your wrist. It's
Oh.
strengthening your forearm and your wrist. So that's good.
Okay, thank you.
Yeah. You're welcome.
And this talk has been great. Thank you.
Thank you. I'm looking in to see if there's another. Is there any more in the chat, Myra?
Yes, somebody asked if are you going to give your class at Center on the Hill again?
It's ongoing. Tuesdays at 1 o'clock. You mean the exercise class? So I teach my strong bones exercise class there on Tuesdays at 1 o'clock. It's the registration has to go through the Center on the Hill. Mary Angela Saavedra there, the director, takes the registration, and we have a class next week. Then there's going to be a little bit of a break, and then we'll be going again. So they're kind of ongoing sessions, and I don't have any intention of stopping that. So I do that, and then my Zoom class, which is Tuesdays and Thursdays at 10 o'clock. And I always record those classes, my Zoom classes, so you don't have to be available at that particular time. And the other thing is, if you're not sure, because I don't have a big ego around any of this, and maybe some of you might be big exercises, or you're not an exerciser and you're just not sure, you could check out the Saturday class. That's only $5. My Zoom class, I mean, it is Zoom, and I know a lot of people are Zoomed out after COVID and everything, but if you were interested, so it's Saturday only, and it's $5. You can watch it as many times as you want, but only on that particular Saturday. And what we do is my website person takes a class that I've done before and drops it in that time slot. And so, all day long you can watch this class, but then you can't watch it again on Sunday or Monday. It's just that day. So that would be a pretty inexpensive way to see if it's a good fit or not.
Just
Go ahead,
so
Barb.
how do you
Oh.
measure geometry of bones?
Oh,
mean-
it's not anything. It's something they do in clinical research. It's nothing that, it's the coolest study where they show all these colors, and they're just mapping things out in a, it was done for the research, and I can't even begin to explain the physics of it. Yeah,
So all we have access to is a DEXA scan.
correct. Sadly.
Oh.
Yeah, they also, I mean, there are some facilities that do the trabecular bone score, which is, it'll usually just show up as TBS on the DEXA scan. They only do that for the spine. And it does give you information about the quality of the bone. It's a very interesting little, it's like they look at all these pixels, and they determine the quality of the bone strength in the spine. So but they do not do that for the hip. And I know, like, Penn downtown will do that, but Chestnut Hill Hospital doesn't do it. So the facility has to purchase the software, so it's money, which is why it's not everywhere. I mean, I'm not a conspiracy theory or cynical person, but that's the bottom line. If they've purchased the software and they load it onto the DEXA computer, it all gets spit out at the exact same time. It's not an extra test.
Right. So it's just
So-
interpreting the data.
It's another piece of data. Exactly. Go ahead, Linda.
I've had a test that's a ultrasound for my hips.
Yeah, the REMS. Yeah.
And I'm gonna get another one So I avoid the radiation of the
the
DEXA.
radiation, right? So there's something that's been out for a couple of years. REMS, radiographic electro something spectrometry. I can't remember, but it's basically getting the same information that the DEXA scan gets, but it's using ultrasound. And so,
Right.
like Linda said, there's no radiation and you get the results immediately. So that's something I'm going to write a blog about that soon, because I've been getting a lot of questions about it.
Is it okay if I put the doctor's information if people want to write it down, or would you
Yeah.
rather I
Is
not?
it Debbie Bernstein?
Yeah, and Dr.
Yeah.
Zambito. Yeah, I could
Yep.
put it in the chat if people want, but I don't want
Sure.
to. Okay.
Absolutely. Debbie's a friend of mine, and I just
Cool.
I like to understand something a little bit more before I kind of say, oh yeah, go do that. So right now, other than the lack of radiation, which is definitely, a plus, I'm not sure if it's really giving us more than what the DEXA scan can give us. But I'm going to find out. Anybody else? Don't forget, you can always email me if you think of something later. Go ahead, Fran. You're muted.
Yeah, you did mention a couple times the DEXA scan isn't the best metric, and I've always wondered, I think it's measuring bone mineral density, right?
Correct. So they're looking at a little section of bone that is scanned, and how many grams of calcium and phosphorus and all those minerals that our bones are really repository. It's a repository for all of these minerals. So they're giving us that, but bone quality is strength and density. So we don't really know what the bone quality is. So somebody could have a pretty crappy DEXA scan and they fall and like nothing ever breaks, so the bones there, that person's bones are more resilient than the DEXA scan is revealing. So that's always one of the questions that I ask is, what's somebody's fracture history? Because that's another way they also diagnose a person, is based on whether or not, a bone or one or more have broken, over the last 10 years.
Yeah, thank you. I didn't quite finish the question, which was, isn't it
Oh.
also true? That's okay. Isn't it also true that there's organic matter in the bone? And maybe that's what you mean by bone quality, because I'd imagine there could be too much minerals and then the bone is brittle. And you want organic to make it, that's what the picture I have in my head, but I don't know if that's actually correct. That the organic.
Yeah, I mean,
flexibility.
Right. I mean, our bones, that they have to have that amount of flexibility, but I think our body is pretty good at, giving us like managing all of these very complex systems. So if we eat, if we're getting adequate food and enough of all of these, minerals and nutrients we need, the bones should be okay. There are different kind of disease processes that can go on that can interfere with that, thyroid problems, parathyroid problems, and all of those things have to be looked at to see if there's a glitch in the system somewhere. So maybe we'll start wrapping up. What do you think, Myra?
I think that's a good idea. I think people have asked their questions. It was a really great presentation. Wonderful information,
Well,
and you're a great presenter. So thanks a lot.
Well, it was my pleasure. And thank you. Thank you again for having me. Thank you. Yeah. You guys are my inspiration. All right. I'm
Thank
going to
you.
sign off. Bye.
Okay, bye.
Thanks.
Night.
Bye.